So we talked about medications for overactivity of the bladder that could potentially cause dementia. Now, we explained why. So some of these drugs actually cross into the brain, and the most notorious one is the first one that was ever made for overactive bladder, called Oxybutinin. Why? Because it's a small molecule, it's neutral in charge, and it can easily cross over. And once it crosses over, it doesn't get pushed back into the blood, it stays there, and it can potentiate dementia. So if a patient is in the elderly age range, has a strong family history of dementia, then we try to avoid this medication. Now, sometimes I have to use it, especially if the other medications are too expensive, but this is one medication I try to avoid in patients because of that reason. So there are other medications that can be given, such as trospium or the beta blockers, and the beta blockers do not have that influence on the brain, such as what the anticholinergics have. So that is what we look after. So we look after our patients, we see what to give. It's not that, oh, I just give the samples that are available to me and just give it to my patients. There is a rhyme and reason. That is why it is so important to do a complete history, understand what medications the patient is taking, understand the examination, understand the diagnosis, and then prescribe the appropriate medication for that particular condition and that particular patient.